Welcome to the Inspire London College. This is the assignment worksheet for Qualify Level 4 Diploma, Communicating in Health and Social Care, with the unit number T5059495. So in this video, I'll guide you that how can you meet the requirement of this assignment by considering its own specific learning outcome and assessment criteria. But before that, you have to provide a short introduction to the topic of your assignment within 150 words, in which you can explain like what your assignment is about, which is about communicating in health and social care. So you just discuss briefly like what communication means in health and social care and why communication is important in this sector. Now, let's discuss the learning outcome 1, which is identify key communication skills and explain how these are applied in health and social care setting, which is all about the basics of communication, in which for the assessment criteria 1.1, first you need to identify different theoretical approaches or models to communication in health and social care, because you have to make a comparison by choosing any of the two theoretical approaches. And while making comparison, you need to explain what each theory says and how these theories are relevant to the health and social care. You also have to make any differences and similarities between these theories. You also can explain different examples, like how these theories help the care professionals to communicate in a better and more effective ways with the individuals who are receiving care. Now for the assessment criteria 1.2, you need to describe like what different methods or types of communication can be used by the care professionals while communicating with their service users, in which you can consider discussing the types of verbal communication, the different types of non-verbal communication, but make sure that you are not bound to only discuss the verbal and non-verbal communication. You are free to search for different types of communication in order to meet the requirement of the assessment criteria 1.2. Moving down, here is the learning outcome 2, in which for the assessment criteria 2.1, you need to discuss the different factors that are playing their part in order to prevent the individuals while communicating with their service providers. You have to explain like how the language, different languages, language problems, language issues, how the different cultural backgrounds or any of the disabilities of the service user are preventing them to communicate within health and social care sector. And for the second part of the assessment criteria, you also have to provide some strategies or ways in order to overcome these barriers, or like what are the strategies that can be helpful for the service user to overcome these communication barriers within the sector of health and social care. For the assessment criteria 2.2, you need to identify different alternative means of communication that can be used by the care professionals in order to communicate with the service users who are with special communication needs or requirements. In this, you can consider discussing the use of different technological devices, the use of sign language, the use of picture boards, any figures, graphs, pictures. So you need to explain like how these alternative way of communication can be helpful for the care professionals in order to communicate with the individuals who are with special communication needs and requirements. Whereas for the assessment criteria 2.3, you need to first explain what confidentiality is and what is the importance of confidentiality in the health and social care sector. And then you need to connect or link this confidentiality concept with the Caldecott principles, explaining how these principles are providing the guidance for the individuals in order to protect the personal information of their service users within the sector of health and social care, like how they should be used in health and social care practices and what these principles are in terms of the information, keeping the information private of the service user within the health and social care sector. Moving to the learning outcome 3, in which for the assessment criteria 3.1, you need to discuss the benefits of the use of information communication technology for the service users, in which you can explain like how the use of online appointment system, how video calls with the care professionals or the use of different healthcare apps help the service users in finding or assessing the healthcare services. So how the use of ICT make the life of the service user easier, and how it makes the healthcare services more accessible to them. So this is all you need to discuss under the assessment criteria 3.1. Whereas for the assessment criteria 3.2, you need to discuss the same thing like the benefits of the use of information communication technology, but in this assessment criteria, you have to discuss the benefits for the care professionals, in which you can explain like how the use of electronic patient record system or the other latest systems help the care professionals to share the information of their service user online, and how it makes their job more efficient, and how the use of ICT help the care professionals to provide better and more efficient care services to their service users. Whereas for the assessment criteria 3.3, you need to explain like what data protection is and how the Data Protection Act can be applicable in the health and social care sector. You need to explain the key roles of this act, what is the purpose of this act, and how the organizations like health and social care organizations need to follow the rules of this specific Data Protection Act in order to keep the information of their service users safe, private, and secure. And once you have discussed all the assessment criteria and learning outcomes, you also have to provide a brief or short conclusion to the topic of your assignment, in which you can sum up everything that you have talked about in your assignment. But make sure that you provide the introduction as well as the conclusion of your assignment within 150 words. And last but not the least is the referencing. This is the bibliography section, in which you have to provide the references of all the sources that you use for collecting the information for your assignment in a proper Harvard referencing style. So this is all about the assignment worksheet of Qualify Level 4 Diploma Communicating in Health and Social Care. And I hope that all the guidelines that are provided in this video makes things a bit clearer for you.